Hello, and welcome to the Northern Regional Medical Command News. I'm Ann Krebs. This monthly program highlights the world-class health care provided at each of our military treatment facilities to soldiers, their families, retirees, and other beneficiaries. April is the month of the military child. The children of soldiers make a tremendous contribution to the defense of our nation through the love and inspiration they provide to the fighting force. The health and welfare of our youngest members is a huge responsibility. We sent our youth correspondent, NRMC kid Alicia Coleman, to Fort Belvoir Community Hospital, a Department of Defense facility. There, she spoke with NRMC family practice physician, COL Mark Harris, about how we maintain the health of the military child.
When somebody comes into the doctor's office, what do you have to check, and what's the reason for that?
Well, it depends on why they came in. So a lot of children come in because they have a cold or because their ear hurts or a tummy ache or things like that. So for example, we'll look in the ear and see if the eardrum looks normal or if it's bright red and looks like it's infected. We'll look in the throat to see if there's bright red tonsils with some white pus or swollen glands or whatnot, which might indicate a strep throat. We'll listen to the lungs to listen for bronchitis or pneumonia. We'll listen to the tummy to see if there's anything going on there, anything wrong there. We'll feel it to see if there's any pain. Depends on why the child comes in and what they need help with.
Is there anything good about getting shots?
There's a lot good about getting shots. Some places you get a sticker. Some places in the past when I was growing up, you even got a lollipop, and that was really good. But what you get most importantly is protection. You get protection against diseases that can cause a lot of trouble. Measles, for example. A long time ago they had smallpox, but even things like polio and chickenpox and things like that, there are vaccines against those. They can protect kids and adults from diseases that would otherwise be very, very serious or could even kill someone. We don't have to worry about those near so much anymore just because of vaccinations. So you get the protection, and you might get a sticker too.
What can kids do to keep themselves healthy?
Well, the best thing that kids can do is, as part of their family, they can do things with the family. They can eat a good, healthy dinner. When mom and dad and the brothers and sisters are having a good, healthy dinner. Lots of vegetables, lots of fruits. Maybe not so much sweetened drinks like sodas, and maybe not so much dessert, although I know you like dessert a lot.
Of course, who doesn't?
Also exercise. When mom, dad, and kids exercise together, then everybody gets better exercise and they can do it together. They can have a lot of fun. Sleep is the same way. Bedtimes at 8 or 9 for kids are better than bedtimes at 11 or 12. All those things, the eating right and the exercise and the getting plenty of sleep, part of the performance triad, is key to parents and kids being healthy.
Reporting for NRMC News, I'm Alicia Coleman.
Across the Army, installations are celebrating the month of the military child. For activities in your area, check with your local youth center. To find out more about the positive influence the performance triad can have on young lives, contact your military treatment facility healthcare provider. In other Month of the Military Child news, congratulations to Kevin McIntyre Brewer, who was named U.S. Army Military Child of the Year by Operation Homefront. Kevin is the son of Kirk Army Health Clinic Medical Detachment Commander Captain Stephen Brewer. The 13-year-old was honored for the charity he founded, Socks for Vets, which collects socks and other donated items for wounded, injured, and ill soldiers and other veterans. His sister Lorelei was a semifinalist for the award. In other news from around the region, Kimbrough Ambulatory Care Center recently held a patient safety awareness event. Kimbrough patients are encouraged to ask questions of their providers because patients' understanding of their health care is a key to building a partnership between the patient and the rest of the healthcare team. And that's NRMC News for April. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, and Pinterest. Thanks for joining us.